Could you please start the role play conversation now? Thank you.
Hello, I'm Nivi, a physiotherapist in this hospital. How may I address you?
You can call me Sarah.
Okay, Sarah, how can I help you?
Yes, doctor, my arms feel so painful. Was having plaster on my arms and my left hand as well. So it's so painful, and I need to see the outpatient physiotherapist as soon as possible.
Sarah, I understand how painful it is. I'm very sorry to say we are already booked for our next week. Whole session is complete. If you don't mind, could you wait for one more week so that we will book you appointment? I would
Yes,
like
doctor,
to.
but can you
Yes,
please
Sarah.
tell something? Yes, doctor, can you please tell me that what can help me to ease the pain, and when should I start moving my hands before my next appointment with the doctor? Can you please tell me, because it's really difficult for me to manage my household chores and all.
Well, Sarah, I understand how hard it is. I would like to ask you a few questions about your fracture. Is it okay
Yeah,
for
sure.
you?
Yeah, sure.
Okay. How have you got this fracture?
Yes, nurse, that's a good question you
Hello?
have asked. Hello. Yeah, I was trying to do
Yes,
some work
I'm
at home,
listening.
and I got slipped,
Okay.
and this has made.
Okay, it means you outstretched your arm and you broke his wrist bone. I'm right?
Yes.
Okay, Sarah, I would like to ask you a few suggestions. You please follow the physio suggestion. It will be really helpful for you. Okay.
Yes, carry on.
Do you have any swelling at the moment?
Yes, I do have swelling. So can you please tell me how to reduce that swelling?
Okay, before we proceed further, I have to ask one more question to you. Could you please explain to me how about the level of pain, 0 to 10?
Well, it's 9. I've got severe pain.
You have more pain. Okay. Okay, Sarah, I understand how painful it is. Okay, you need to do some mild exercise to reduce your swelling, and you need to elevate your arms. Did you wear plaster on your hand?
Yes, yes, I was wearing plaster, but now I'm not wearing plaster. So I feel like
you need to.
I'm having.
Yes, Sarah, please proceed.
Yes, while wearing the plaster, I was not having any sort of issues, but after removing the plaster, I feel like that I'm having a lot of pain, and I'm not able to do any sort of activities at home. And as you mentioned that I have to do some mild exercises, it will be very difficult for me to do. You tell me something that this swelling can be reduced.
Don't worry, Sarah, you are in safe hands. You please need to wear the plaster in your daytime, and you need to immobilize your arm. Okay, you need to support your hand in the plaster and do mild exercise for your fingers. That really improves your circulation. Okay. Are you clear?
That I understand. But I have severe pain, but it's very difficult to perform exercises immediately. But I need some suggestion regarding the swelling so that it can be reduced.
I understand your situation, Sarah, but unfortunately, you need to mild exercises. Okay,
Okay, let me
I
see.
will take few tips. You please follow this thing. Please don't apply any hot packs because you already have swelling, and if you apply hot packs, it worsen your situation. So please do gentle exercise, like you can slowly bend your fingers and open your fingers, close your fingers and open. You continue this 10 times and this improves the circulation and your swelling will get reduced. And another thing, you need to do some mild stretching to your arms. You remove your plaster and then do your elbow bend and stretch your arm forward. Bend your elbows and stretch forward. So you can do 5 times. So if you
Okay.
do this simple exercise, really you feel better and your swelling got reduced. Is it
Okay,
all right
doctor.
for you?
I'm convinced. I'm a bit convinced from your suggestion. Well,
Okay,
it sounds good.
okay,
And
Sarah.
please, can you tell me when will I be able to resume full activities?
Okay. Like it's already 6 weeks now, and you need to start doing your exercise. And will you please visit our clinic on 1 week later? So we will provide you the leaflet, and you have detailed information about your exercise plan. Okay. If you have any questions, please contact me at any time.
Okay. Okay, that sounds better. Fine.
Okay, Sarah. Have a nice day.
All right. Both of you were able to go through the role play conversations in a smooth and effective manner. But I would like to give the feedback on Nivi's speaking communication skills, okay? And then we'll go from there. All right. So your introduction was amazing. So you have done a good job. Well done. Okay. All right. You were able to show sympathy. You were able to show sympathy and empathy, more appropriately this time. More appropriately this time when compared with your previous role plays. Okay. So you have done a wonderful job. Okay. This time I'm happy with that. And then there were some mistakes, grammatical mistakes that you have committed. For example, you have said our sessions are fully booked. Okay, so that's what you have said. So you shouldn't have told that. It's wrong. So don't give false starts. Okay, you can say we are fully booked for this week, or you can say our sessions are already booked fully. Okay, or fully booked. Okay, so false starts need to be avoided or reduced. All right, so that is an issue. And then you said I will book you an appointment. You said I will book you an, so you said appointment only, you didn't say an. So you should have told I will book an, or I'll book you in an appointment. Or you can say I'll book an appointment for you. So either can be used, but you have said I will book you appointment. That is wrong. Okay. And then how you got this fracture? How you got this fracture? All right. It's not a grammatically incorrect sentence, but there is a better way of asking the question. So how did you get this fracture? Okay, how did you get this fracture? Okay, that would be much better. All right, and then you said I am right. That's wrong. It is am I right? So once you asked the information, you need to say am I right? So the good thing is that you were able to ask the information to the patient appropriately, correctly, and effectively, and you were able to confirm the information as well. So I'm very happy with the way that you have been confirming the information with the patient. Okay, that's really good. All right, so you have done a wonderful job, all right, in these things. And then you said I would like to Instead of saying I would like to share with you some suggestions, or I would like to provide some suggestions, or I would like to offer some suggestions, or I would like to give you some suggestions, you have said I would like to ask you some few suggestions. Okay, this is wrong. You're not going to ask her. No, you have to provide her, isn't it? You should say I would like to offer you some suggestions or few suggestions. Okay, that could have been much better. All right. And then you said level of pain. Could you please tell me about your level of pain 0 to 10? This is wrong. So what you should have told is, I would like to ask you, or I would like to know the level of pain on the scale of 0 to 10. Okay, level of pain on the scale of 0 to 10. Okay, that is correct. All right. And then some mild exercise, that is wrong. Some usually goes with what? Mild exercises. Okay, it needs a plural noun after them, usually. Okay. All right. And then you were able to address the patient's concerns. You're able to address the patient's concerns very well. However, you could have encouraged the patient to some extent more appropriately. I mean, when she says that she has got some pain, okay, she can't move her hands, or whatever, legs, or whatever it is, you could have mentioned that, well, I understand that it may be difficult for you to move your hands or do some mild exercises at this point in time. However, if you don't do these exercises now, then the recovery time will be extended, or you may have few additional consequences as well. So what I would like to do now is to recommend you to start with the maybe stretching exercises only for maybe 2 minutes a day, and then see how it is going on. If you feel pain, you can stop and ask me for my suggestions or advice. So you can say something like that. Do you know what I mean? So I understand that it may be painful, but start for a short period of time, like 1 minute and 2 minutes. Try to do this maybe for only one time or twice, at least. And then slowly, if you don't get pain, if you don't feel much pain, you can continue increasing the frequency of these exercises. Otherwise, you can report to us if you have any pain. Okay, you could have encouraged that way. Do you know what I mean? So it wasn't, I mean, you are trying to address the concerns, that's fine, but you should encourage the patient to do the exercises, isn't it? So you could have told them, okay, I understand the pain, but could you please, or if you could maybe do this maybe for once or twice, and if you feel pain, you can let us know, and then I'll provide you alternative suggestions, or things like that. Could have done that. Okay, that is missing. Okay, I mean, it's okay, you got most of the things covered, but these are the things. Connectivity could have been improved as well.
Okay.
So you should have used more connecting phrases, but you haven't done that. So that is not good. Okay. And then you said if you apply hard packs, okay, you said it worsens. Okay, it's not it worsens. Okay, they worsen. So if you apply hard packs, they worsen. It's not it worsens, because hard packs is a plural noun, so you have to use they and then the verb after that. Okay. And then you have encouraged her to some extent. Okay, you have done that. And then you have asked her to come to clinic on 1 week later. Okay, that is wrong. All right, you can say please contact us, or contact us after a week. Okay, or you can say, you can use this one as well. Sorry, one moment. You can say please come to our clinic 1 week later, or so on. Okay, that could have been done. But the area of improvement could be grammar. Absolutely, grammar could have been improved a bit better. you have improved your grammatical accuracy dramatically. So I'm very happy with that. You are able to commit only less number of mistakes this time. So it's really good. This time you have committed less number of mistakes only. I'm very happy with that. Vocabulary is perfect. Okay, I'm happy with the way that you have been using the vocabulary. So it's all good. You were able to establish rapport with the patient very well this time when compared with the your previous attempts. So I'm very happy with that. And you have used a range of sentences. I'm very happy with that. That's good. But some sentences have got mistakes. Okay, that could have been identified and rectified. But apart from that, it was a decent performance. Okay, it's not that bad. Okay, let me go through the expected score. So, okay, to some extent, you have performed really very well. So you have committed, let's say, 1, 2, 5 is not a mistake. Okay, 6 is a mistake. And then there are a couple of other mistakes. In spite of these mistakes, you have been able to get 350 for this role play conversation for the first time. I'm very happy to give you a 350 out of 500 for this role play conversation. All right, you need to be a bit mindful about your grammar mistakes. Okay, you need to still reduce these mistakes, because you have committed about, I think, maybe 9 to 10 mistakes which could have been avoided. Okay, but other areas such as showing sympathy and empathy towards the patients, addressing the concerns, and establishing rapport with the patient, and so on, getting the information, confirming the information with the patient, and so on, have been improved dramatically. And that's the reason I'm happy to give you 350 out of 500 for this role play. Well done, Nivi. You have done a wonderful job. I'm very happy.
Thanks, Steve.